earlier this week, or should I say last week, and we had a few questions from our community. I wanted to take this period to answer some of those questions, okay?
Yes.
All right,
You're
so
welcome.
we'll dive right in while we wait for other people to join. But our first question is, can someone that has tiny fibroids get pregnant?
The answer is yes.
Okay?
The answer is a very big yes.
Okay.
Yes.
All right. Our second question is, what are the symptoms of fibroid in the body?
It's going to come into the series. Um, you want me to take it again now and then it comes into the series again?
Just give us a taste of what we would get.
All right, fine. Let us say that one of the earliest symptoms you have might have to do with bleeding.
Okay.
It's actually menstruation coming at a cyclic time,
Okay.
but the flow becomes heavier.
Okay.
It might be prolonged.
Okay.
It could be so heavy that it becomes incapacitating to the woman.
Oh.
Yes, and then bleeding can be such that after menstruation she feels dizzy. She feels easily tired. She has headache. All because she's lost so much blood and then anemia has set in. So it can actually be a very harrowing experience. The other thing that could happen is pain during menstruation.
Okay.
And the pain could start just the day of menstruation or days before the menstruation. It could be so excruciating, it could be intermediate, or it could be very mild, but pain comes in, and that's what we call dysmenorrhea.
Okay.
And then you can also have abdominal swelling. As the fibroid grows, the abdomen starts increasing in size, and sometimes it gets so much that you'll be wondering whether the woman actually is pregnant or not. There are also those people that will have problem with urination. They notice that they urinate more often, frequently they urinate. And then there's those people that might have problem with going to toilet, in which case they have constipation. And then there are those that because of the mass, they have what you call uterovaginal prolapse. The whole uterus, the whole vagina, they are all going down, coming down. Sometimes they actually can feel it or even see it outside the body. Yes, so these are bits of the, but we have details of them in the series on that.
Okay. Well, this is a very eye-opening experience. Okay, can I just ask a question? This is not a question that's here, but would that mean that every person who has that pain before their menstruation has a fibroid?
No, it doesn't. It doesn't. There are so many other things that can bring pain during menstruation, even outside menstruation.
Okay.
There are so many other things that can cause bleeding to increase and so on. But we are saying that people that have fibroid might have these things. And not one person will have all of them at the same time.
Okay.
Yes.
Okay. I felt that a lot of our listeners might have that question.
Yeah, that's
A lot
okay.
of people also have menstrual cramps and all of that, just to clear that out of the way. All right, moving on to our next question. It says, is it true that if a fibroid tumor has been removed from a woman, that she may not be able to take in again?
It's a very common question, and I think that's a question that the people that I call supplementalists or the herbal doctors, I think that's something they capitalize on. Fibroid surgery is not a surgery for the boys. The experience should be allowed to do it. You are trying to go to the uterus to operate, to take something out of the uterus, and the woman may, or most women still want to have pregnancy at some time in their life. So it's a very careful surgery. It's a surgery that requires the expertise of someone who has the experience. And so it's not true that every woman that has surgery will not be able to get. No, it's not true. But some might not be able to. And that comes from the experience of who is doing the surgery. It comes from the technicalities of the person that's doing the surgery. It comes from a lot of things. So it depends on a lot of things. Yes, there are some that might not have, but to say that most of them is not true. Our patients come back to come and deliver, come back to put to bed, and so it's not. There are those that if the because of the technicality, because of their system, the patient might not even menstruate again. You know, these are the things that you want to run away from when you want to do fibroid surgery. And it's not everybody that you go and then go to do myomectomy.
Okay. All right. Another question says, is there any medicine that someone can take to stop uterine fibroids from growing?
Let me answer this question like this. I have a feeling this person is talking about what is going on in the mythology of uterine fibroids, where everybody has something that is going to sell to you in terms of herbs and so on that is going to shrink the fibroid and so on. From our own angle medically, there is a drug that can shrink uterine fibroids. It comes in injection form.
Okay.
You take one injection every month.
Okay.
As long as you continue taking this injection, the fibroid will be put in check.
Okay.
What will tell you any day you stop taking the drug? The fibroid is going to grow astronomically. We call it a rebound effect of the drug.
Yeah.
So the fibroid comes back and comes out so heavily, so much bigger than it was before. That's why we don't use it.
Okay.
When you see us use it, maybe you want to go and remove the uterus entirely, and the fibroid is so massive. So you start it so that it brings you to a manageable you can.
Okay.
The other place that I use it is if I'm going to do isoscopic myomectomy. I'm going to explain that later when we talk about treatments. But here we're going through the uterus. It's fibroid that's inside the cavity where baby is supposed to be, and then you just want to go and take it out. So you want to get it smaller so that it doesn't bleed and you can finish the surgery in one taking.
Okay.
So that way you can shrink it. You're going to take that out. But to use it for the bigger fibroids, and the drug number is not good because of two reasons. One, the drug is very expensive. It should be about 100,000 now for one injection, and then once you start to continue through life until you get into menopause, then the fibroid will not come any day you stop it. So it's such an expensive drug, and nobody actually maintains it in our environment because of hardness of things and things. So we actually don't go there. But then this question is coming from the side of those that use herbs. The herbalists will tell you that their herbs are going to take out the fibroid, they give it to you, it melts the fibroid, it shrinks the fibroid, it dissolves the fibroid, you vomit the fibroid, you shit out the fibroid. Jesus Christ, so many things that you hear, and none of them, there's no truth in them. That is the truth. There's no truth in them. Yes.
Okay, I think you've actually answered the next question. It says, are there no ways to deal with fibroid except through surgery?
In the first place, it's not all surgeries that you operate on.
Okay.
When fibroids do not cause any problem, when the fibroids are not very big, observe it and follow it up. When fibroid is found and we are getting towards menopause, we ask you to temporize, because after menopause it doesn't grow again, from our knowledge. So it's not all of them that you must go and operate on. But if it's symptomatic and you want to treat it, you might have no other cause. There are some methods we are using in the past, which I'm going to touch when I'm going to deal with the treatment in the series. There's something we call embolization. In embolization, you're not cutting the patient. You're going to look for a vessel and put in a drug that's going to block the blood supply to the fibroid. And if the blood supply is blocked, it's going to go down. But that's a procedure that's on its own, actually, entirely, and it's not a very commonly done procedure. You know, there are some other methods that are not available in our environment. They are not available. If they are available, they are going to be very expensive, and the people that have fibroid might not actually be able to use it. There are modern methods. There's what we call focused ultrasound. Now you are going to use this ultrasound wave, convert it into heat energy in order to destroy the fibroid. It does not remove it, but it stops it growing, and the body resolves some of it over time. Okay? But you can see that it's such an expensive procedure.
Sounds very expensive.
It's not even available in our environment. It's not even available in around us. Okay? So there are some other things you can do, but by and large, if the fibroid is giving a problem, you might just have to go in and take it out.
Take it out.
Yes.
All right, thank you so much for that. Our next question says, in a situation where a person is diagnosed of fibroid that is 3 centimeters, though the only symptom the person is having is abdominal pain, which is not too much, the person is also having difficulty in conceiving, and her period comes every month. Could it be a result of the fibroid or something else?
It could not be. When you talk about 3 centimeters fibroid, I'm sure if you look at my fine finger, you're going to find we're looking at something like this. That's what we're looking at.
Okay.
Okay? 3 centimeters. We'll find fibroid that are 11 centimeters. We'll find fibroid at 10 centimeters, 8 centimeters. So 3 centimeters solitary fibroid might not be the problem. It might not be the problem. It might not be the problem. Unless it's intracavitary, that is to say, it's inside the womb, inside the cavity of the womb, then that's where it might be the cause. But otherwise, actually, the connection between fibroid and infertility is not so clear.
Okay.
No, it's not a clear cut. You can't say that every woman that has fibroid cannot get pregnant. It's not true. We have women, I tell you something. We had this lady that was pregnant, and we actually thought it was twin pregnancy. And everybody thought it was twin pregnancy. And the scans were giving out twin pregnancy until we went to deliver the woman. We got in there, brought out one baby, started looking for the second baby. You know what we found? We found fibroid that was bigger than the baby we brought out.
Wow.
So the woman had it and then she got pregnant. I had another woman that had a uterine size of 36 weeks. That's 36 weeks size pregnancy.
Okay.
And she was only 9 weeks pregnant. 9 weeks. She had only 9 weeks pregnant. 9 weeks. And somebody said, come, let us remove the fibroid. They cannot grow together. I said, I don't think so. You didn't put it there. And fibroid and baby, they are brother and sister. And they are only being housed by the uterus. Let them alone. Eventually, we were able to go in at about 35 weeks of age in order to take out that baby. Very beautiful baby, very intelligent baby now. So, fibroid and pregnancy, neither here nor there. There are those people that they have fibroid, they have infertility, prolonged infertility. And you go and remove the fibroid, they get pregnant. So, you can see, there's no clear anything. Unless the fibroid, and I've seen a case of that, if the fibroid is at the corner, the corner is if you take this body as the uterus, the tubes come out like this, If you have a fibroid that is here, another one that is here, blocking the tube, and I've seen a case like that. Very unfortunate case. One woman, we did laparoscopic surgery on her, and then we found that, look, there's a fibroid here, blocking here, one blocking here. That one you can say, yes, it's stopping the pregnancy. But don't forget that if it blocks only this one, the other one is open, and she can't get pregnant. And in those ones that are even in the muscle, no matter how many they are, might not stop. So the relationship between fibroid and the pregnancy is actually not so clear cut. So those that have fibroid can get pregnant. Those that don't even have fibroid might not get pregnant. That is what it is like.
Okay, all right. So could be something else. It could be fibroid, but we don't know what it is. All right. Is it true that fibroid is common to any woman that has gotten to the age of birth before 35?
It's common. Somebody said the uterus is supposed to carry something. It's supposed to carry a baby. Now, if the uterus doesn't have any baby to carry, the person said it carries fibroid. So it's not as if it's that common, or it's common. It's common, but not invariably.
So
It's
would
common.
you say it is more common in women who have not given birth?
Looks like.
Okay.
Yeah.
Okay. So next question.
You know why? Because in pregnancy the fibroid does not grow.
Okay.
In pregnancy, it only undergoes what we call red degeneration and necrobiosis, but it doesn't grow. So the whole 9 months of pregnancy, there's no growth from the fibroid.
For the fibroid.
Yes, it only undergoes necrobiosis, becomes much redder than it is, but not growing in size.
Oh, okay. All right, our next question says, what is the main cause of fibroids since it is common in black race?
A very nice question. I like that question. You know, many places I've talked about this, and then it makes a nice, very painful topic. Cause of fibroid is not known. This is the truth. We do not know what causes it. Why don't we know what causes it? Because there's nothing you can find out without research. It's only through research you can find a cause of anything. And that should be an honest research, for God's sake. But I want you to try to imagine what happened at during COVID-19. So much money was pumped into finding treatment for it, finding vaccine for it, finding what to do for it. And so, why did they do that? Why is that the disease of the blacks? It was killing the white men. And so they are pushing money into it.
Yeah.
Without that money they pushed in, there's nobody that could have found anything that could have helped anybody. Look at that of HIV too.
Yeah.
And see the amount of money they put into HIV. Why? Because if they don't have it in their place, somebody travels from here to that place, can get them infected.
Yes.
But this one is not an effective disease.
Okay.
No, it's not effective. So in order to check what is the cause of it, we need research. And Nigeria, blacks do not want, no matter how much money they have not gotten to that level of forming a foundation that can outlive them. It's only when you have that type of liberal mind that you can now think of what will benefit the society, that more people can benefit from. We're still at the level where we are thinking of ourselves and then our families, and then we keep things for them.
Yeah.
That is the main problem. If anybody is interested, we're able to at the time to get to see an institution that says outside Nigeria, that says if you come, if you want, we can help you find the cause of fibroids.
Wow.
When I came back, I was talking about it. Nobody was interested. But if anybody is interested today, we can still try and see. I'm passionate about it because so many people have it. People are suffering from it, and it will be nice. It will be a wonderful thing to find a cause for it. Maybe if we find a cause for it, it is something that can be preventable. Maybe one day we'll find out, look, hey, it's because of this that it comes, because of that it comes. Or if we find a cause of it, maybe we can now somewhere truncate its growth.
Yes.
See, the fibroid in the blacks, they are giant fibroids. Fibroids of 6 kilograms, 9 kilograms, 10 kilograms, 11 kilograms. And one woman was telling me recently of fibroid of about 18 kilograms. I doubted that, but I know I have pictures that I don't know what to expect when I go to remove those fibroids.
Wow.
So we have giant fibroids in Africa, and it will be good to know, to find the cause. Well, maybe somebody from our discussions who might be interested, and then we'll look for it. It is not a research of percentage. It's a real research that we don't know how long it's going to take, and materials have to be used. You have to get the fibroids and then get it analyzed. It's going to be a wonderful thing to be able to find the cause of fibroid. The truth is that nobody knows the cause of fibroid, even at this time, despite our development.
Okay. Wow, that's very enlightening. Okay, so this is our last question that we've gotten from the community. The question is not necessarily about fibroids, but it's still a question that somehow gets to talk about women health. So the question says, can someone be pregnant and still be seen menstruating?
That's a nice question. I keep hearing that from time to time.
Okay, so
If a woman is pregnant and starts seeing blood from the genital tract, there's a problem.
okay,
The pregnancy is being threatened. That's the least.
okay,
The least that is happening is that the pregnancy is being threatened.
Okay.
If it is at the beginning of the pregnancy, nobody gets pregnant and continues seeing menstruation.
Okay.
A woman was trying to convince me, yes, it happened to her. I say it's not true. If you know the procedure, if you know what happens in pregnancy, it's difficult to see any blood unless the pregnancy itself is being threatened. And if it's at the early stage of pregnancy that the woman is pregnant and it's not pure, it's seeing blood, call it blood. We call it threatened abortion or threatened miscarriage. That threatened miscarriage can be carried to inevitable miscarriage. It can actually be a case of incomplete abortion, complete abortion. Okay? If it is towards the later part of pregnancy, then we are talking about antepartum hemorrhage. And antepartum hemorrhage is a killer. Antepartum means before delivery, bleeding starts before delivery. It's one of the worst killers of women. There are two major parts of it. You have abruptio placenta, you have placenta previa. Placenta goes, instead of going to stay at the upper part of the womb where it's supposed to stay, it goes to stay at the door of the womb. Previa means door. And so it's difficult if you start bleeding then, it's difficult for the baby to come out. Placenta should come after the baby had gone out. In this case, placenta is staying where baby should go out from. So how are you going to do it? And then in abruptio, the placenta is supposed to separate after the baby has been delivered. But for one reason or the other, the placenta separates while baby is still inside there. It can accumulate more than 1-2 liters of blood in between the placenta and just the abdominal wall. And the more separated the placenta is from the body of the uterus, the less oxygen goes to the baby. And if you are not careful, the baby will die inside. So nobody, there's some things you hear in this part of the world, and you start wondering when we are going to be free from the type of bondage you are inside. There's no reason why someone should think, oh, he's pregnant, and then he sees period every month until he delivers. It's not true. There's no physiology that explains that.
I think maybe one of the things that people don't understand is what it means to actually see menstruation when they are pregnant.
It's possible.
Some people have spotting.
It's possible.
Very light blood.
Yes.
And then because it comes every month,
yes.
they just take it that
yes.
it's menstruation.
They should actually be in hospital so that they see whether they can salvage the pregnancy.
Okay. All right. Thank you so much, doctor. So that's the last question that we have. Can you give us a teaser? Tell us what we are going to expect in the next series. The next series will be released tomorrow. So, what should we look forward to?
I think the next series is going to talk about the incidence of fibroid, isn't it?
I think so.
Yes. It tries to help us to see, one of your questions was how common fibroid is.
Yes.
Now, that is what we are going to look at in the next series.
Oh.
Yes. How common is it? Which people have it more? Is there any explanation for why the way we see it in these people? That's what is going to come in the next one. And I think it's not a very verbose thing, but it's going to be precise. It's going to be very fine. I'm sure. I don't want to let the cat out so that you look at it. I don't let the cat out.
Okay. All right. Thank you so much, doctor. Thank you so much for this time. We really appreciate you answering questions that we have, and we look forward to having more questions when the second series has been released.
You're welcome.
Thank you so much.
The pleasure is mine.
Lovely evening.
Thank you so much.
All
thank
right,
you, Jennifer.
We'll talk to you next question session.
Thank you very much. I'm very grateful. And thank you for the crew. Great job. Thank you very much.